Welcome to True Health Tuesday, and the truth will set you free. The truth today, we're talking about arthritis, joints, and the incredible failure of the medical system. What's a trip? I know it seems kind of harsh, but can you imagine, and some people will say erroneously that we're living longer. This is why the joints are just wearing out. Okay, well, that's not true. When we talked about aging, going over accurate records from about 300 BC, okay, human lifespan hasn't changed in about 2,000 years. So we're not living longer, we're just being poisoned. So let's look at how the world is. Okay, we want instant fixes right now, yeah? We're not taught that the body's intelligent, so if you have a symptom, you get a medication, okay? And that's it. So when people talk about the opioid crisis, it's like, oh my God, this is so horrible. All of these people are addicted. Where the hell did they get them? They got them from a complete failure of the medical system to appreciate that the body's intelligent, to give them medication to find the problem. Because I don't think anyone is suffering from a lack of non-steroidal anti-inflammatories. I mean, you do a lot of research. Have you ever seen that study? Yes. Steroid deficiency syndrome. No, that's insane. So we're looking at symptoms, and if the doctors start to change their ideas that the body is actually smart, my God, you've got this weakened tissue where the rib is falling up underneath the diaphragm. That's an intelligent response by the body because the tissue isn't working correctly, or you have this pain that's radiating down. We're not going to give you a drug or something to cover it up. We're going to find out the source of the problem. Wouldn't that be cool? So now we're going to hit two main types of arthritis. And so I get a lot of complaints about get to the point. It's like, you describe the problem, just tell me the solution. So I'm going to tell you the solution in 2 slides. But first I got to describe a psychosis of errors. And this happens a lot. Now we're going to cover the rheumatic diseases in one group, because this is where the body's immune system is breaking down. It's actually confusing. It's destroying itself. And we're going to talk about the most common type of arthritis, which is osteoarthritis. But before you get into this, arth means joint, itis means inflammation. Okay, so when I say arthritis, I'm saying joint inflammation. Now, inflammation's a healing process of the body. Here's a little bit challenge. Osteoarthritis is a non-inflammatory joint inflammation. No, that's true. Okay, now if that sounds odd, okay, that I'm saying joint inflammation, then this is a non-inflammatory joint inflammation, people make mistakes and they just perpetuate it. They don't go back and correct it. Welcome to the medical system of America or the planet. It's also called degenerative disc disease or degenerative joint disease. However, it's a result of a trauma, not a disease process. Okay, so and when I actually had to answer some questions on this, how can you say arthritis can be reversed? Well, it's a trauma, and the public can be confused because it's not a joint inflammation and it's not a disease, even though it's typically called degenerative disc disease. In fact, that's the billing code that you put for it, but it's a result of a trauma, not a disease. There, I'm glad I cleared that up. Okay, now we're going to do rheumatic diseases. Okay, this is not where the body is attacking itself. Okay, that's psychotic. Okay, but this is a massive weakening of the immune system that has to do with gut health, immune system responses that are artificially stimulated, and literally the body breaking down. And you'll see similar aspects to this. So now we're going to go over solutions. And this is really basic. We're going to expand on the solutions. So this is just for the people, the Cliff Note version. Osteoarthritis is not a joint inflammation. It's not a degenerative disc disease, even though that's what it's called. The solution is to correct the biomechanics because it is the result of a trauma. So if you have a joint that's not aligned correctly, you have to realign it. Now, we had a patient last week, and she came in for knee pain. Now, 75-year-old gal. And I said, well, you know, we have to look at the whole body. And she said, no, it's my knee. It's my knee. And I said, okay, I'm sure it is. But you know, you're sitting like this, your head's forward, you have redness and swelling here, your skin looks like hell, you've got bunion formation, okay? And so with the bunion formation, we know that the biomechanics of the foot are compromised. So does anyone think that you can have a good, healthy knee if you walk like this? No, that's going to be altered mechanics. It's not going to work right. So I'm trying to explain this, that when you're going to fix a knee, you got to make sure that the blood is healthy. You got to make sure that you're in a physiologic state where you can regenerate tissue, because we're going to be causing inflammation at that joint. Inflammation is how the body heals. So when people says it's arthritis, by God, this is the body trying to heal. So it's smart. So in order to correct osteoarthritis, which is not inflammation, we have to get the joint realigned, correct the mechanics. Then we have to, but when we're correcting the mechanics, let's just take the knee for the hell of it. Okay, we've got the quadriceps that passes it. Now the quadriceps is innervated by nerves in the low back. So do you think that you should look at the biomechanics of the lumbar just to make sure that the quadriceps is working? Yes or yes? Yes. Yeah, okay, now, knowing that the nerves that supply the feet come out of the pelvis, if there's a pelvic dysfunction and the foot is starting to flatten out, do you think that we could possibly have a healthy knee joint when the biomechanics of the foot are not there? No, that's insane. Now, since we've got two bones together, which are the knee joint, it's surrounded by a synovial membrane, it's filled with synovial fluid, which is a superfiltrated blood. Should we get healthy blood? So can a person regenerate a joint if they have a crappy diet? No. So that doesn't make any sense either. So literally, to correct osteoarthritis, you're going to restore the biomechanics of the entire body. You've got to look at this as a holistic problem. You got to get the blood healthy. This means diet, supplements, and don't poison yourself. You got to reduce and eliminate the toxins. Okay, that's really clear, because if you're, I don't know, let's just say you're getting 72 doses of 17 different vaccines by the time you're 18. Let's say you're getting completely, absolutely, totally ineffective vaccines before 1 year, before you can really develop healthy antibody production. So you're just causing an inflammatory response, okay? And that breaks the body down. Those are toxins, okay? And they create a negative response in the body. And then deal effectively with your physical, chemical, and emotional stressors. So what we're talking about to correct osteoarthritis, which is not a disease, not degenerative disc disease, it's an actual trauma, you got to fix the problem. Does that make sense? Okay, now let's look at rheumatoid arthritis. And this is all the rheumatic diseases. So we're going to check scleroderma, lupus, psoriatic arthritis, polymyositis, and dermatomyositis. So we look at these, and they're all similar, where the body is producing antibodies and it's breaking it down. And so when you look at this, should we correct the biomechanics to make sure that the joint can start to regenerate healthy? Absolutely. But does that mean the biomechanics of the entire body? It does, doesn't it? So you got to start thinking, can somebody start to regenerate a joint if they sleep like crap? No. Could they have great biomechanics but have an unhealthy diet? No. Or taking multiple medications that limit the body's ability to heal? No, this doesn't make any sense. So when you're looking at these conditions, you got to look at the entire immune system. Now, knowing that 80% of the immune system's in the gut, and this is an immune system problem, do you think we have to heal the gut first? Yeah. Absolutely, yeah. So you're looking at leaky gut, so you're looking at eliminating grains, eliminating toxins in the food, preservatives, MSG, all of that. And so we're going to go into how to heal the gut. You got to heal the gut. You got to correct the biomechanics of the whole body. You got to heal the gut. Then you got to get your blood healthy. So this means you can't eat poison, and you got to have appropriate whole food supplements, and you got to have a healthy diet. Then you have to reduce and eliminate the toxins. So this means the medications you're taking, the chemicals inside of the food, and the chemicals that are injected into your body that create an inflammatory response. These are the vaccines. And then you have to deal effectively with the stressors. That means the physical, chemical, and emotional stressors. So both types of diseases, you're fixing the whole body. It's not a joint problem. It's a joint clue. It's like driving a car into a mechanic and saying, that damn red light on the dashboard's pissing me off. And the mechanic goes, buddy, there's the engine. No, the engine's underneath the trunk. I just want that light off. Okay, so let's look at the role of Western diet in autoimmune conditions and inflammatory conditions. Now remember, this is the current allergy and asthma journal. So when you look at this, inflammation is how the body heals. Okay, so inflammation means there's been tissue damage. That means the current diet that we have is damaging our bodies if you're eating the standard Western diet. So we're looking at developed societies have successfully reduced the burden of infectious diseases. However, now they've created an environment where metabolic, cardiovascular, and autoimmune disease thrive. So what about that measles epidemic? Measles, benign childhood disease, and it turns out if you get it, you have decreased autoimmune problems, decreased cancer. So there's a benefit from the childhood diseases? That's interesting. So now autoimmune rates are rapidly increasing. So why is that? What population of animals on the planet are getting something that their body's being destroyed? I mean, think of a giant herd of caribou up near, where are you guys from, Canada? Okay, yeah, so you guys, what, ride them or something up there? Okay, so when you're thinking, just think of this, think of like 1,000 head inside of caribou. Okay, and then we have a group that their body just starts to attack themselves. I know what you're thinking. We should run up there and get some methotrexate, get them some non-steroidal anti-inflammatories. That's a great idea. Maybe, shoot them with a little bit of chemotherapy drugs. Or do you think maybe we should look at what they're eating or exposed to? Yeah. Drugs, I know. I'd go with that first thing too. So with the rapid increase in autoimmune diseases, it clearly suggests that environmental factors are playing a role due to significant increase in these diseases. Genes do not change in such a short period of time. Hence, most of the inflammatory conditions we have. So when we look at this, think of this, all joints in the body, or in the majority of them, two bones coming together, surrounded by a joint capsule. Now in that joint capsule is a fluid that's a superfiltrate of blood. This is why when people have unhealthy blood, such as diabetics, it can't get in there, so the joint can't get nutrients. Now you have some psychotic ignorance called medical doctors that don't understand this. I mean, when a joint is under pressure, okay, that's putting pressure on the cartilage, okay, and that cartilage is covering the bone. So people will look at the cartilage and they say, well, it's avascular. That means it doesn't have blood vessels. No kidding, there's a lot of weight on that. But it's not acellular. So cells always have to do a couple of things. They got to take in nutrients, produce proteins, eliminate waste products. So that the cartilage in there has to get its nutrients from the synovial fluid. And you'll see one of the contributing factors in rheumatoid arthritis is that the membrane of that synovial member, okay, that capsule, thickens so it doesn't allow healthy blood to get in there. So the structures can't get nutrients, and that's what destroys it. So the blood health in relationship to the joint is vital, because that's a superfiltrate of blood. So now you're looking at this, you got the two bones coming together surrounded by the joint capsule. If the blood is unhealthy, like that, a diet high in polyunsaturated fats, and think of the health nut, okay, the health nut that wants to go 100% healthy. So they get the almond milk with the almond butter with the, almond bread, and then they eat a couple of seeds. That's going to be polyunsaturated hell. And so the blood starts to stick together also. And that's called rouleau coin formation, or roll of coin formation, the one on the upper right. And that's a toxic blood response. It also forms those coin-like things where all the red blood cells stack on one another if you're under high stress. And this could be physical, chemical, or emotional stress. So obviously that is not going to transfer the nutrients or oxygen to the tissue. Now, what's the prevalence? According to the CDC, you're talking 1.3 million people of just rheumatoid arthritis. Now we're seeing a massive rise. Now, when we look at the overall population, we have the sickest animal species in the world. Okay, and we're looking at 54% of our offspring in America have a chronic illness or disease they'll never recover from. So these are small numbers. When you're talking 860 per 100,000, so since this is on the rise, and let's just look at the official version of this, the causes of rheumatoid arthritis, according to the CDC, what causes it? Now they're describing it here. They say the immune system attacks the synovial membrane. Really, what causes the immune system response? Nothing here, because it's unknown. The resulting inflammation thickens the synovial membrane, which can eventually destroy joint cartilage and bone. So something is attacking it. But when we look at the Mayo Clinic, the doctors don't know what starts the process. So we know it's been growing up like crazy, okay, rising in incidence in the last 40 years. And while your genes don't actually cause rheumatoid arthritis, they can make you more susceptible. So we know it's not genetic, we know it's environmental, we know that the gut is a huge factor in the immune system. So does anyone think that there might be, an environmental cause to it? Why not? Except we're not going to look at it, okay, in today's society. So these are the actual causes of rheumatoid arthritis. And I could not go through and get all the data to put it in a 45-minute talk. Okay, and since we have a state of emergency in Washington, I put a couple of slides in there to show that the vaccine schedules are actually contributing to this. No one got that sarcasm, a state of emergency in Washington? Okay, I know you guys are not from the country, okay, neither are you, but okay, we're talking 50 people now have, although I think it's going down because it only lasts around 10 days and everybody gets better. Thomas Jefferson, if a law is unjust, a man is not only right to disobey it, he is obligated to do so. We're looking at an unjust medical system. You no longer can go along and be an innocent bystander. The line is drawn here. We have to change this, and if not, the rest of the population will not survive. Now, in 1986, a law was passed absolving all the vaccine manufacturers of any liability of their product. So you're going to see I used a couple of references that show that the vaccinations are a causative factor in arthritic problems. A causative factor, not contributing. Because now we have to, since the liability law was passed, and thank goodness for the pharmaceutical industry to fund our media and to fund our government, it makes it much easier on us. I mean, we still have to pay taxes, but at least there's controlling influences out there. So arthritis associated with induction of rubella infection. It is suggested that repeated episodes of arthritis which followed the rubella immunization may be related to the continued presence of the rubella virus in the affected joints. See, when we're injecting a foreign protein, this is a completely abhorrent way that your body is going to be exposed to a pathogen. And then in order to mount an immune system defense, in that vaccine, there's things they add in there. They're called adjuvants. And this is to get your immune system to react strongly. Now, this is 1971. Now, you might remember, anybody alive back in 71? And you were just a twinkle. Twinkle in your mom's eye there, buddy. Okay, no, but those of us that were realized that the vaccine manufacturers they had so many lawsuits, they were going out of business. So this was written in the climate that there was actually freedom of press and freedom of speech and actually scientists that were actually looking at science and they were wondering why the population was getting sick. Okay, this one from 1983, viral infections and immunity, prospective immunological assessment of arthritis induced by the rubella vaccine. Again with the rubella vaccine. Now they're saying arthritis occurred in 10 of 37 adult female volunteers within 17 days of the immunizations. And so you start to see this and you think, well, my God, no wonder, because back at that time there were only around 20 vaccines, not the 72 doses that we have forced on us today. And so you could see that there might have been a challenge. Now, this is interesting because in our culture, we can't really badmouth the vaccines, but we can badmouth those damn ingredients. Honest to goodness. I'm not kidding. Okay, there's a system or a syndrome called ASIA, which is adjuvant-induced response to vaccines. And so again, there you can say someone has this ASIA syndrome, which is an autoimmune condition and their body just wastes away. Or you can say, you know, it was the ingredients. It wasn't really the vaccine. Okay. What? You think that's funny? Adjuvants are used in many vaccines, but their mechanism of action is not fully understood. Wait a second. This is from 2013. Adjuvants are used in many vaccines, in fact, all of them that I know of. Do you know any of the? I think all of them, yeah, because you got to have something in there. Okay, but the mechanism of actions are not fully understood. So I'm thinking, damn, load, shoot, aim. You know, baby, let's just do it. You know, let's get the stuff out there, because we're really not going to find out how devastating this medical procedure is until we shoot everybody. Okay, so let's just force it on the population and just see what crops up. Okay, and honest to God, that is what we're doing. Okay, understanding the mechanism of the adjuvants will provide critical information on how innate immunity influences the development of adaptive immunity and help in the rational design of vaccines against various diseases, and can inform on adjuvant safety. If we don't know how they're working, why don't we stop, take a chill pill, and just settle down and see if we can, you know, do appropriate studies? I don't know, I'm thinking like a randomized controlled trial, double placebo blind trial using actual inert placebos, not comparing it to an existing vaccine. So let's just do something different. Okay, like treat it like it's a real drug. Okay, now this, the role of the microbiota. See, one of the reasons we're being poisoned is because the food today is destroying our gut flora. This is why when you have an autoimmune condition, when I say heal the gut, this means no grains, okay? Particularly, you know, when you're talking American grains, which are soaked with glyphosates, and the glyphosate is damaging to the bacteria, and the microbiota in your gut is vital. It's vital for your immune system response. But just like the caribou, if they were eating stuff that destroyed their gut flora, they would develop joint problems. Do they have medication deficiency, or are they being poisoned? Okay, good, just checking. Okay, and this one we know, and again, this is from 1999. The question between vaccines and autoimmune illness phenomena is surrounded by controversy. If something in science is surrounded by controversy, how about we do more science? Just, you know, or we just say to heck with it. We really need to study this, but let's just shoot first and ask questions later. They know the measles and the hepatitis B vaccine are associated with multiple sclerosis. They're seeing a rise in that. I would think it'd be cool to do a study where you're going to shoot people that you don't like with this, and shoot people with maybe a saline and follow them. Okay, for what do you think? 5 days, like the hepatitis B shot? Okay, or 5 years? Okay, I'm thinking, you know. So this is not a studied process unless you look to the left and to the right. Before the law was passed, it was 23 doses. Now currently it's 72 doses. But back when the law was passed to absolve the vaccine companies of any liability, there was no forced vaccinations. That only happened in 2010 when they started to force, you know, of course the military has always been forced, but the healthcare workers and everything else. I mean, it's insane. This is one of the main reasons when we're talking about arthritis and the implication of an autoimmune condition causing it, and how vaccines are a causative factor in autoimmune conditions, only because we have another couple of years where you're going to have the forced adult schedule. So remember, when we're talking about the dialectic, okay, how to control a population, you create a fear, you create a problem, a scenario, and you have to blame a group. You have to blame a group so that you can have a known reaction. And then you have the solution. So you have the problem, reaction, solution, and this is how you can control a population. So you don't look at the 28,000 autistic people in Washington state. You don't look at the over 800,000 children under 18 with a chronic illness or disease. You look at the 50 people who have measles, it's a benign disease and they'll get over as long as they have a sufficient amount of vitamin A. When you look at the death rates and the damage rates from the entire disease population that we have up there, it's a total media hype. It's insane. But this is what the adults are going to do. Now, how they're going to force you because you don't have to go to school, it may be driver's license, it may be passports, it'll be something. So let's look at the health of kids today. So when we're talking about arthritis, this is grade 1 arthritis in a 2.5-year-old. Now, the World Health Organization says C-section should be about 7% of the population. We have some states that are 50%. Okay, now during a C-section, now granted, the mom's belly is cut, the kid doesn't get the healthy skin flora, 4 times the amount of pressure is placed on the child's neck and they're pulled out. Now the kid, in just a normal kid, isn't going to have healthy antibody production for the first year. But don't let that worry you because within 12 hours they get the hepatitis B shot. Okay, now he developed multiple ear infections, which is interesting because ear infections, the British Medical Journal says they're not infections at all. They're actually ear effusions 93% of the time. So this means drawing the fluid out of this red bulging eardrum and putting it in a petri dish, it doesn't grow. So that means it's sterile. So that means that the soft palate in the neck, which is controlled by the nerves that come out of the top of the neck that's damaged in this little child, okay, they're not functioning correctly. So it's really a soft palate dysfunction brought on by neck trauma. So now let's look at the most common type of arthritis, osteoarthritis. Is that a real joint inflammation or a not joint inflammation? If any medical professional can explain why we perpetuate stupid, I am totally open to changing it right now. Okay, I know you would, Doc, okay? Buddy, I'm with you, man. Okay, so when you look at this, understand it's from a trauma. That's it. It's just a trauma. So when we look at this, we've got grade 1, 2, and 3. Grade 1 is immediately after a trauma or a young kid. It means the bones aren't in the right position, but there's no destruction of the disc or bone. Grade 2, you're looking at minimum destruction of the disc and bone. We're seeing actual structural changes there. That takes between 5 and 8 years. Grade 3, you're looking at 10 to 15 or more years to have that amount of destruction. But I want you to look at that grade 3 over there, okay, on that side. You'll see at the top of the neck a curve, and then at the grade 3 where it curves backwards and it's destroyed. Okay, in that curve, do you see healthy joints? Just say yes. If you haven't seen a lot of x-rays, that grade 3, the C2, C3, and C4, those are beautiful healthy joints. There's not a stitch of arthritis about it. So that means that when you have a healthy curve, that the joints don't get destroyed. The problem is you're looking at 15 to 20 years of damage in grade 3 to even develop that. So this is the real challenge. I get, there's bad doctors in every profession, but I'll get somebody in grade 3 and they'll say, "Yep, Bob, it's old age. I've seen it before." Okay, really? How old are the bones in the top? I figure they're out of the same age. You understand? So I'm looking at joints of a teenager at the top of that grade 3 neck that have no destruction or degeneration, and we're looking at a massive stabilization because that's what it is. It's from a trauma. And when those discs get compressed, it changes, it distorts. And we're going to go over that more because I want you to really own that one. That the body, when it's called osteoarthritis or degenerative joint disease, we're going to be changing it to arth function. Okay, and it's a stabilization aspect. This is an intelligent response by the body based on trauma. Now this is the Bible for biomechanics. If you're going to teach biomechanics, this is what you're going to use. And this is what I used when I taught biomechanics. So what they did is they took cadaver bones out of old cadavers and young cadavers, and they put them through compression, torsion, everything. They found out that old bones were just as strong as young ones. Wait a second, so does that mean that we don't wear out? Does that mean that we can continually regenerate our tissue? Absolutely. You know, we can keep going till 120. You're looking at, how many people in this room can do a handstand like that? Okay. Okay, a few. Show off. Okay, but see, we don't need to age like that. We can, you know, always regenerate our tissue. But look at this, okay? You're looking at a neck here of someone that's traumatized. They have a reversal of the curve. Now, in order to get a reversal of the curve, you had to have torn a ligament, the posterior longitudinal ligament. Now, discs get their nutrients through movement, through imbibition. And if you've ever seen a cadaver, and one that you could like open up, you can take a probe, which kind of looks like a pen, and you can pass it through bone pretty easy. Okay, bones are very porous. You can't beat it into a disc with a hammer. Okay, because a disc is 80 interconnecting rings of ligamentous tissue. The challenge is there's not a lot of healthy blood supply to the disc. So it gets its nutrients through movement, through imbibition. So what do you got? First, osteoarthritis, trauma. Accident happened, altering the motion. All the muscles spasm out because the muscles that run down either side of the spine, there's no pain fibers and there's no control. They're called postural muscles. So you get these tightening of the muscles, and that's why when you get up in the morning, stiff and tight, that means that there's some joint damage or destruction. So those muscles are increasing in tone in order to stabilize and protect the nervous system, which controls every function. Now, so in our society, are we taught to respect our body and symptoms? No, we're not. Yours, maybe. By God, if it hurts, what do? In fact, how do you spell relief? R-O-L-A-I-D-S, okay? Man, that commercial I've been on in 40 years, okay? Okay, so we look at it, we're always looking for the pill to cover it up. So we're not taught, by God, if you have that stress, you got that pain and stiffness, you've got some joint compression. You've got to get yourself to the corrective chiropractor immediately, get a stress x-ray, don't worry about the radiation, it's very low, okay? And get your body checked to see what's going to work. Then we look at this. So those discs, if they don't get their nutrients, they start to get compressed. So what does the body do? The body elongates or increases the surface area where the two joints are connected. So this is an intelligent response and a stabilize. Now what you're going to see is to correct this, you got to restore the biomechanics. So what does that mean? You got to put the curve back in the neck or the low back, wherever it is. You got to cause inflammation. That causes the cells to regenerate so the discs can regenerate. Discs are alive. I actually had to explain this to an orthopedic surgeon who came in here with a reverse curve in his neck. He didn't want to get surgery. I said, Doc, discs are alive. Really? I've never heard of that. Okay, Doc, do you have dead tissue in your body or do you think it's alive? Well, now that you put it that way, I think it's alive. Okay, so does that mean they got to take in nutrients, produce proteins, and spit out waste products? Well, I think so. That's it. Think of this. There's an entire profession that gives a non-steroidal anti-inflammatory at the first sign of a symptom. Why? Because the patients want to be comfortable and uneducated. I want to educate you, I want to cause some inflammation, and we want to reverse that so that you can be in charge of your body. I think that's better. So these things, the joints get better. They literally get better. So again, look at this. I want you to, we got an MRI, we got a really cool, funky x-ray that's got a reverse curve, and we have normal. So look at the bony distortion. Okay, think of this. Bam, trauma. Okay, whiplash, it's something. You know, you get hit by a crazy chiropractor. Okay, bam, we got the trauma. Okay, now the disc can't get its nutrients because it can't get the correct movement. So the body increases the surface area. This is where bone spurs come from. This is why when they call it degenerative disc disease, it's not degenerative, it's not a disease, it's a stabilization aspect of an unstable area. This is an intelligent response by the body. So how do we correct it? We restore the curves. That restores the motion, restores the nutrients, and then there's a law called Wolff's Law. Bone is laid down where it's needed, resorb where it's not. Then you see the bone spurs go away. How do we know? Because you can see it in pre and post x-rays. Okay, so now here, again, you're looking at normal on the right. You're looking at an abnormal one. What do you see here? You're seeing that the bones are literally distorting and changing shape. You're seeing the disc spaces change in shape. Okay, so this is an absolute, and you're looking at 30 to 40 years of damage there. So what does that mean? That means that person on the left had pain and discomfort, and either they just didn't care about the numbness in their hands or the elevations in blood pressure that'll occur from the damage like that, or they weren't taught that the body is intelligent, they give symptoms for a reason. You know, what do you think? Yeah, we got to change this world. Now, chronic pain, and I love this one. Welcome to the opioid crisis. This is from the hearings, congressional hearings. This is before the opioid crisis. This is how you create one. You go before Congress and you say, addiction isn't common. Addiction is rare in the patient that's properly managed. Try the opioids. I'll give a free one to every member of the Congress. You know, I mean, can you imagine that? Okay, you know, I mean, if he was doing this out of the back of a wagon. Okay, so this is the start of the opioid epidemic that's you know, kills a lot of people. This one is Vioxx. This was a great one. It's gentler and safer on your stomach. Brand new type of pain reliever. Amazing. It went through 6 years of study. Okay, so they did, you know, placebo-controlled trials for 6 years. I mean, this was really good. Of course, I know you might say, well, weren't the studies run by the manufacturer? Yeah, but come on. Don't be so picky. How prejudiced could they be? Well, it made $2.9 billion in 2003. This was profitable, as long as you don't add in the count of life. Okay, I mean, it's up to, they're saying over 100,000 people, because there was a myocardial infarction signal. When they were producing or getting this before, one of the journal articles, overall mortality rate and the rate of death of cardiovascular causes were similar in the two groups, the placebo and this. It's mind-blowing. So, have you been lied to by the public? By the people in authority? According to the Journal of Law and Medical Ethics, the myth of safe and effective drugs, myth that there is no safe and effective drugs, that you're taking your life in your hands by altering your physiology with a chemical. Granted, some people need them. Type 1 diabetics need, okay, that insulin. If you've had an organ transplant, you need the anti-rejection drugs. If you've had a thyroid removed, you need the Nature's Thyroid or Armour's Thyroid. You need those. That is not the majority. I'm talking about going down to the AM, PM and seeing 15 different types of non-steroidal anti-inflammatories that you're taught that you need for better performance. This is psychotic. The pharmaceutical industry has corrupted the practice of medicine through its influence over what drugs are developed, how they're tested, and how medical knowledge is created. Could we add to this? The pharmaceutical industry has corrupted our government, has corrupted our media, has corrupted our children, has corrupted our population. We could, but that might be a little bit overbearing. No. Okay, the authorization of user fees in 1992 has turned drug companies into the FDA's prime clients, deepening the regulatory and cultural capture of the agency. When we go down to the bottom, unless this corruption of the regulatory intent is reversed, the situation will continue to deteriorate. Independent FDA leadership, public funding of all FDA activities, measures to discourage RD, research and development on drugs, with few, if any, new clinical benefits, and the creation of a National Drug Safety Board. Anybody know what the FDA, Food and Drug Administrations, used to be called? Chemistry Board. Chemistry Board. They were to be the liaison between the chemistry companies and the public to assure you that everything that they're producing is fine. It's just fine. And so they want a National Drug Safety Board. Okay, yeah, like that's going to happen. Okay, now if things are done right, see, this is why we talk about diagnostics, that it's completely insane. You spin a diagnostic wheel, you take somebody with similar symptoms, and you put them in a category of a certain disease. This way, if you treat that person for fibromyalgia with the muscle relaxant, antidepressant, anti-inflammatory, and sleep medications, and they have a negative response and drive into a group of people and kill people, you're okay. You can't be sued as a doctor because you're following the standards of care based on that diagnosis. So if everything is done correctly, this means the right drug at the right time and the right dosage. According to the Journal of the American Medical Association, 128,000 people a year will die. If this was the airplane industry, okay, if this was how we fly from city to city and 128,000 people a year die from flying correctly, okay, do you think the FAA might have a challenge? Yeah. This is why we have the accident investigation team separate from the FAA. So we don't have the people passing the laws checking the damage. It works in airplanes. We have some of the safest airplanes in the world. Why can't we do it to food and drugs? It's just a thought. Well, again, the annual physical is outdated. Why? You should not go to a medical system, okay, because it results in a battery of unnecessary tests. It's ineffective at preventing disease, unnecessary processes and exams. It makes sense in theory, but it really hasn't borne out in reality. Why? Because it's a complete failure of the system. Let's look at this. We've got before and after. Does this person have a physical alteration in their structure? Yes or yes? Okay, now if I stand on your foot causing you similar discomfort, guess what happens? You're sympathetic. This fight or flight nervous system kicks off. And then what happens? Elevations in heart rate, decreased blood supply to the gut. Chronic stress like this is going to turn that person, and the frontal lobe is not going to function correctly. That's impulse control. And so then you're going to have impulse control issues, focus issues, brain fog. Yes, I know. Stop bringing that up. We have drugs for all of those. Gosh, talk about a troll. Okay, how about we just respect the body, that those symptoms are there for a reason, and fix it? Okay, this is the patient that came in with the knee issue. Okay, and I'm trying to describe, your knee joints, they're pretty good. There's a little damage on one, but there's not a lot of bony distortion. We can fix it, but we have to look at the whole body. Okay, no, I'm just here for the knee. Okay, thank God she let me take a look at her, but you're looking at a loss of curve, you're looking at significant structural damage. Anybody think she sleeps good, poops good, just likes to go jogging except for her knee injury? No, this is insane. Until we get people educated to respect their body's processes, this person will never get better. And what you're looking at here is a 58-year-old, 20-year-old trauma. So what we did is we take a neutral, and this is for all the doctors out there. You take a neutral, you're going to see degeneration. Seeing the reverse curve right there, that means that this person had a whiplash trauma based on the amount of damage minimum 20 years ago. So how can you prove to the patient that you can fix it? You do a stress x-ray. That's the stress x-ray right next to it to see if there's joint movement. And if there is, then you can accept the case and give predictability. You can say, yes, we can restore this. Why? Because we just saw that everything worked. Okay, does that make sense? And then you put them under a series of care, and then you take a second x-ray to actually document that you're fixing the freaking problem. Wow. No, we don't give them Advil. Okay, so now, when you're taking an x-ray, and this I want to be really clear, we're looking at the hard palate. The hard palate can move 15 degrees without affecting the curve in the neck. So when you're doing a post x-ray, and this is a post x-ray, has anyone in here ever heard of Acroyoga? I didn't either. Okay, it's so weird because I'm thinking yoga was like a religion, meditation and everything. No, these guys are flipping people up in the air. They're zipping them around. We had one head injury of of one person was holding legs like this and the other legs like this, and they did a cartwheel together. Except one person dropped the other person, the head slammed into the ground. So this is, so Acroyoga, these are cool people. Okay, just, because I like neat injuries, and this is kind of a neat one. So he's got a reverse curve, and then that's him later. But again, when you're looking at a full restoration of a curve like that, an Acroyoga person, do you think they have a good diet? Yeah, this is a man's man. Okay, this guy sleeps good, works good, great mental, great physical. I mean, we've had some people, and again, totally unvaccinated. His family is unvaccinated. They own a little farm. I mean, this is totally different. We've had a few specimens like that come in, and they've had questions about, Doc, my doctor is really concerned about my testosterone. It's high. And I said, yes, he's never seen anyone like you. You're normal. Your parents are unvaccinated. You don't take any drugs. You're unvaccinated, and you eat a healthy diet. You're odd. Yeah, so we look at this, and again, we're looking at before and after, but I'm showing some really nasty ones, okay? But I want you to look at the reverse curve on that first one on the left. That's what they came in with. So even if you're looking at 40 years of trauma there, the human body, just look in the mirror and smile, because the body has got 100% potential for recovery, whatever the position is. And this is a really sweet gal. This is a bending film to find out why her diaphragm was weak. Okay, this is called slip rib syndrome. But you can see the abnormal bowel gas up there, disc injuries, gut inflammation, SI joint inflammation. But when we're talking world-class athletes, is this a person that's been injured and pushes it beyond? Hell yeah, God bless her. Jesus. So this is a person that's able to put away injury and push it. Okay, but also too, at least they understand that, the body can be regenerated. Here's before and after. We actually asked the surgeon to remove some of the steel plates that they put in, and they were nice enough to do this because when you look at the steel, when you put steel and fuse a spine like that, particularly when there was no trauma, by the way, no trauma. She was able to carry a 60-pound sack of concrete across her yard before they did the surgery on the left. And then she comes in and she's shaking like this. Granted, we only have a couple of bones on the top and a couple on the bottom we can adjust. But the shaking, when you're altering proprioception, you're altering information in the brain, the body's going to start to increase it. So she had this chronic shake in order to keep her brain functioning. So they took out the bolts, that's the bag of bolts they took out of, and they put in new bolts because they actually removed part of the bones in order to correct the sideways shape of the spine. It's mind-boggling. It's mind-boggling. I mean, and this, granted, we see people from everywhere, but this is common. So let's look at non-steroidal anti-inflammatories. When we're talking about the dumbest thing in the world, this is not the dumbest thing in the world. This is criminal. This is the dumbest thing in the world. I'm going to give you a drug that makes your joint pain decrease. It's not going to make it go away, but you'll feel more comfortable. However, it destroys the building block of cartilage, so your body will be destroyed early. But you'll be comfortable. Don't worry. Okay, but you do have a 40 to 60% increased risk of cardiovascular problems, hearing loss, gastrointestinal bleeding, a lot of complications with these drugs. Congenital heart failure, allergic reactions, miscarriage, and atrial fibrillation. Of course, nobody has AFib and pain, do they? No. Also, cardiovascular, myocardial heart attacks, stroke increases, serious adverse events. Okay, what's a trip is, this is the warning for Tylenol. And anyone know the deadliest drug in America? Tylenol. Yeah, but it is gentler and safer on your stomach. Okay, so it's insane. The toxicity and therapeutic benefit from this is incredible. I'm actually going to do a talk on where acetaminophen came from, and it was acetaldehyde or something. It was something back in the late 1800s that was so deadly. This was the metabolite of it, so they were able to pull one drug off and put the other drug on. It's really criminal, unless you like mystery novels. Let's look at this. When you have a misalignment, some type of trauma, you first have an alteration of movement. That's kinesiopathophysiology. That causes an alteration in nervous system's function. Now, if anybody, I could demonstrate it on you. You can come up here and I'm going to step on your toe. Does anybody think that would change your heart rate, perhaps? Okay, maybe vasodilate, okay, your blood vessels to your arms and legs. Maybe dilate your pupils, okay, and shut blood supply down to the gut. Yeah, you got an alteration of movement, you're going to have an alteration in an adaptive physiology. That leads to muscle problems, changes in the actual cell structure, and then that results in the symptoms. The problem is we're dealing with just the pathophysiology, the symptoms, and not fixing the problem. So now let's look at it. Modern Rheumatology Journal. K2, now this is going to be in fermented foods, but it's fantastically important. If you're taking a vitamin D3 without K2, you're not getting the utilization. Okay, apoptosis of rheumatoid arthritis, synovial cells. Wow, rheumatoid arthritis was damaging the synovial membranes, and this can repair it. So what are the good sources of this? Well, and again, organic animal fermented foods, so Gouda cheese, brie cheese. I mean, you need to get this in your system. Fermented foods, if you're dairy-free, will work fine. You have to optimize your gut flora. This is the key. This is why vaccines are going to cause leaky gut, toxic foods are going to cause leaky gut, 80% of your immune system's in the gut. This is why taking medications can actually damage your gut. Anything you put in your mouth has to go through the wall of the intestinal tract into the liver. So this is why liver or hepatic toxicity is so common. Fatty liver disease used to be just from alcoholics. Now we're getting fatty liver disease in 10-year-olds. No, they're not drinking. Okay. It's high fructose corn syrup, the #1 source of calories in America. A chemical product that has a limitless shelf life because no bacteria are too stupid to eat that shit. Okay. But this is something that you take in and it damages your liver. So healthy fats, fermented veggies, probiotics, it seems too simple to say, look, what would you do? But correlate it again. We got a group of caribou that have existed for thousands of years running through the tundra, and there's a small group that have rheumatoid arthritis. Does anybody think we should drug them or find out what they ate? Okay, let's correlate it to humans. Okay. Curcumin, and this tastes good. Okay, microenvironment, which helps the effect of pro-inflammatory cytokines. Okay, it literally helps the body support the regeneration of articulating cartilage. Do you know how many doctor or patients have come in saying their doctors say that cartilage can't regrow? So walk them through it. Is it dead tissue or living tissue? Okay, if they say dead, do you know what you do? You fire that doctor. I know that's the wrong finger. I did think it would be rude if I used the right one. You fire him, okay, because he needs to find a different profession other than working with humans. Okay? Anti-inflammatory, antimicrobial, antioxidant, anti-neoplastic properties, turmeric. I mean, it's carotenoids. This is one of the greatest things that you can do. Why? Because when we're talking about carrots, they have anti-mold properties. And if you've taken courses of antibiotics, antibiotics are generally poisonous molds. So you need that anti-mold property. Astaxanthin. I mean, just look at this. Carrots, sweet potatoes, kale, spinach, butter squash, mustard greens. God, I should not do this on days that I fast. Okay? Seriously, that carrot looked really good. That's mental. So when we talk about the solution And I talked about it in the first slide. It seems too simple, but that's how the body works. You know, how would you correct the caribou problem? Feed them right. Let them go play. Okay? You know, just treat them normal. To get your body healthy, you need to have proper nerve supply. You got to have regular exercise. Why? Because that's how joints regenerate. You move them, they rebuild. We've got one patient that has, I think, 4 or 5 Super Bowl rings. They're huge. And he comes down here, we're talking late 50s, and he was one of the people in the field that would run a lot and get hit a lot. His joints are perfect. There's not a stitch of arthritis. This man is steel. I mean, if he was in a liquor store robbery, the bullets would bounce off. Okay, but his joints, perfect. And you can't find a guy with that much trauma, but he was so consistent with not doing drugs, but exercising, maintaining the integrity of his joints. Just brilliant. Okay, proper nutrition. This means that you put it in your mouth. That's healthy. Your body's going to become it. So if you have an autoimmune condition, this means no dairy, gluten-free, dairy-free, animal product-free for a while. Get healthy starches, you know, such as potatoes, but get lots of vegetables, lots of healthy fats. Sufficient rest, prayer and meditation. It just makes sense, doesn't it? Now, all of these courses, we're talking about bone health this month, and we're going to have a lecture on bone health that's going to be up there eventually. I screwed up. Last week I didn't check the sound, but you know, the one on bone health that we did last week, we're going to actually have it maybe this weekend. And check out our video database, because our disease database on this is incredible. I have time for 2 questions, but I have to repeat the question because I only have one microphone. Yes, ma'am.
Then why do diabetics, the pancreas, quit working if it's dead? Can it not be regenerated?
Oh, why does the pancreas on diabetics, is it dead? Does it keep not working? You're talking about 5% of the diabetics that have a problem with the pancreas. Okay, that's type 1. That's literally the body had damaged that. It's like if you develop antibodies towards an organ system, that organ system is going to start to fail. And that's what type 1 diabetes, that's 5% of them.
But it's still alive.
It's still alive, and you can do it. So this is what happens. And this is why if somebody is a type 1 diabetic, you've got to look at the physical, chemical, and emotional stressors. Because if they have a bad diet, they got to use more insulin. The more synthetic insulin, the worse their body fares. The better diet, the better the body works. And if anyone has a curiosity, and I'd recommend you do this, is watch Dr. Gabriel Cousins' Simply Raw. They had 6 diabetics there. 2 of them were type 1, and both the type 1s that went through it got better. Okay, so you can get the pancreas working correctly. 95% of diabetics are type 2, which is a blood poisoning. It's not too much insulin, too little insulin. It's the blood is poisonous, and that when insulin's job is to go in and knock on the cell door to open up to let glucose go into the cells are so saturated that it's called insulin sensitization. They're not sensitive to insulin anymore.
Can I ask another question? Nobody else is holding up your hand. Oh, somebody else.
Yeah, no, go ahead.
Okay. So if someone has had the thyroid removed, can a piece of a thyroid be placed back in it and grow too?
No. If someone's had a thyroid removed, can you put a piece of the thyroid back in there and have it grow? Not that I know of. But you can do that with the liver in an infant. So based on the amount of cell regeneration, and infants have a huge amount of these cells that are undifferentiated, called stem cells. This is why some kids can get a finger cut off and can regrow. So it's exciting stuff, and hopefully we're going to develop the technology that we can do that. Yes, sir.
Is there a method of healing angina pain?
Is there a method of healing angina pain? Yeah, you find out what the problem is. No. Well, you figure angina is chest pain, so typically that could be from either constriction of the muscles on the chest, it could be from a distortion of the chest, could be from dehydration, it could be from the nerves that supply the heart, it could be from hardening of the arteries, because you got to figure most people have a toxic deficient lifestyle, and if their diet is high in polyunsaturated fats or toxic foods, the arteries literally start to get compressed. So in order to fix chest pain or angina, you got to look at everything. You got to look at the heart, you got to look at the structure, you got to look at the physical, chemical, and emotional stressors. You got to look at the whole body. Hey, let's think of this. If you've got chest pain or angina, should you check the pelvis?
Sure.
You mean you shouldn't look at just the area of symptom? You should look at the whole body? By God, thank you, I feel heard. Okay, next week we're going to go more into this unless there's something weird in the news. Like if there's another measles epidemic somewhere in crisis and state of emergency and, bait and switch. Thank you very much.